Hi guys, it's Chelsea and I am here at the Stepping Stones Behavior Guidance Play Center. I want to talk to you today about functions of behavior. I am going to talk to you about how to identify the function of a behavior and also why to identify a function of behavior. The why is the most important concept for you to walk away with today. I know that a lot of times behavior plans are written without specifically targeting and addressing the function of that behavior. And so you know what happens with those plans? Behavior does not get any better. And honestly, generally it gets worse or maintains, or it may increase in duration or intensity or that sort of thing. We are going to talk about why today and exactly how to know what is it that your kid is getting out of this behavior. Maybe your child, maybe your client, maybe anything, any being living that is able to have a behavior. Okay, so what are the functions of behavior? I'm going to go through this a few times. So I would suggest that you take notes. If I'm able to get tech savvy and put some notes on here, I will do that. Otherwise, take notes. I'm going to go in order that I think they are most prevalent, not necessarily most important, but most common that we see. So first is attention. Second is escape avoidance. Third is access or continued access. And fourth is going to be sensory or automatically reinforced. Now, like I said, I believe that attention function is most likely the most prevalent that we see, because any behavior that we somehow notice, we are somehow attending to. So even if we're planned ignoring as the clinician or the teacher or the parent even, the fact that we're aware that now the child or the client is behaving differently means that somehow we attended to it. Ideally, we're not giving eye contact if it is an attention behavior. However, even some of the other functions, like escape or sensory, usually we are giving some type of attention to it. So what an attention behavior looks like is, and you know what, let's talk now about a behavior. Just in case you're not sure about it, behavior is anything that we can see, observe, or experience as far as our senses, another person to engage in. So behavior is anything that happens. The behavior I'm going to use as an example today is going to be a tantrum behavior. So, and let's define attention. I am going to define attention, and when I speak about it, this is what I mean in this video and the sequence that goes with it. When I say attention, I mean the change in the environment is that someone shows with their behavior that they see or experience what you're doing. So for example, you may have a child, Johnny. We're going to name our kid Johnny. Johnny gets picked on a lot, but Johnny has a tantrum. I look over at him. I don't say anything, but it startled me. So I look over at him. I don't say anything. I go back to what I was doing. I just gave Johnny attention. I attended to his behavior. So he had a behavior tantrum or behavior initiated tantrum. And what changed in his environment? Prior to the tantrum, prior to the behavior, I am whatever, paying attention to what I'm doing. And now behavior happens. I look over. I might look a little bit startled or, make some type of body movement or gesture. And even if I go back to what I was doing, I just attended to his behavior. So the change in the environment, the change in Johnny's environment is that someone attended to the behavior. And that is a very mild, attention. That's not like I didn't yell at him or run over and say what's wrong or whatever. However, I want you to understand that the change in Johnny's environment was attention was given in response to his behavior. So attention generally looks like any of the following, but you can probably add some other ones in. Somebody says something, somebody looks, somebody maybe gasps. Like sometimes we'll have a kid that has some aggression and they'll bite us and we already know it's attention to maintain. We're not supposed to attend to it. But like there's been so many times where I'm like you just can't help it. You know what I mean? It's an elicited response. However, it is still a response that is, in response. It is a change in their environment based on that behavior that they did. So that is attention. Definitely, verbal reprimand is attention. A lot of times, especially parents, I'm a parent, but I'm going to pick on parents, especially parents will think that if they verbally reprimand their child, they get a serious tone or yell or even an angry tone, they think, well, I'm punishing them. That's not attention. Well, the change in that child's environment is that you are now attending to their behavior and you're acknowledging that behavior based on, or by verbal. So you are giving attention. Okay, so we are going to move on to the next one. The next one I'm going to say is escape avoidance. So that is categorized as one. The simplest way I can put this is to get out of the mix. Let's imagine it's a mix of something that the kid does not like. It's a non-preferred or aversive. Escape is to be in the mix and get out of it. Avoidance is to know the mix is over there and not get towards it, not get into it. So escape is a change in the child's environment. So again, we're going with the same behavior tantrum. I'm using this because I really want you to see and understand that the same behavior can have amongst different kids different functions, and usually does. We can't treat every tantrum the same. If Johnny has a tantrum, we identify the function. If Susie has a tantrum, we identify the function. We can't just say a tantrum is always about getting out of something or always about getting attention or always about sensory or whatever. We have to specifically identify it based on that kid. So tantrum, same looking tantrum, and now it's not Johnny, it's Joey. Joey has a tantrum, and if the change in Joey's environment is that he, one, gets to get out of something that he's currently in. Now, I'm going to warn you, let's not assume that, oh, well, because it wasn't aversive, it's not homework, it's not chores, it's not, cleaning the walls or playing with a non-preferred person, it must not be escape. We cannot assume that. If Joey was engaged in something and every single time he has a tantrum, we take him out of that situation. So let me give you an example. Timeout. Timeout is not always punishing. And sometimes a timeout is exactly what that kid is wanting and expecting. Okay, so Joey has a tantrum, he's involved in something, and every time he has a tantrum and he's in the middle of something, anything, or a particular activity, we take him out of that activity. Guess what? We are now allowing that tantrum to change his environment by allowing him to escape the thing that he's in. Now, if there is an activity that is introduced, so we say, hey, it's going to be homework time. Let's go do our homework. And now a tantrum happens. And because of that tantrum, the change in the environment is that we were moving towards homework. It's homework time. Let's sit down, do homework and whatever. But now tantrum happens. And now guess what? We wait out the behavior. Guess what? We're allowing Joey to avoid homework. So now this tantrum is serving to avoid something. It could be that you think your kid really loves a certain movie. Maybe they do really love, they show all of the signs of really loving something, but every time you turn that movie on, they have a tantrum. And every time they have a tantrum, the change in their environment is you pause or turn the movie off. Same thing. So let's not get so wrapped up in, no, it has to be a non-preferred, it has to be something aversive or painful for it to actually be or escape or avoidance function. A little bit later, we're going to talk about that we find the function based on the consequence, not based on the antecedent. So based on what exactly changes in that environment when that behavior happens. So when Joey has a tantrum, when Johnny has a tantrum, how does their environment change? Does their environment let them out of an activity? Well, then we're not going to say what happened before. We're going to say the consequence. We're going to say what happened right when he had a tantrum. That is what the function is. And of course, we need to do several trials of it, several opportunities. We need to see it. We can't just say one or two. Okay, our next one is going to be access or continued access. So, change in environment is access. Now let's find another kid. Let's say Susie. Susie has a tantrum. Her tantrum looks just like Johnny, just like Joey. She has a tantrum, and when she has that tantrum, we remind her of, hey, remember you're working for your blue ball. We didn't give her the blue ball, but we reminded her about the promise of access to the blue ball. If this happens 10 times in a row, we're going to say most likely this behavior is maintained or the function is access. So mind you, a couple of things. Access does not have to be immediate for every child, every person. I know that when we're looking to reinforce a behavior, we say immediately give them access to the thing. However, let me ask you this. If you're an adult watching this, or even if you're a kid watching this, if somebody says on Friday, you're going to get your payday. For an adult, you have a job. On Friday, you're going to get paid. If you're a kid, on Friday, you're going to get your allowance. Every day of the week, Monday, Tuesday, Wednesday, Thursday, you do what you're supposed to, not because Monday, every second you do it, they're giving you something. But there is the promise of access to a tangible, which is money, which is a reinforcer. So let us remember that if we are promising to give access to something, as long as it is a child that is cognitively aware enough to understand the concept of time and understand that even though you didn't give it to me right this second, I believe in your word, you're going to give it to me. We are giving access, okay? So it's going to fall within an access function. I think sometimes it gets confusing about but wait, right when he did that, I didn't give him anything, but you just told him, hey, if you get up off of that floor in Target, I'm going to give you a Snickers bar. And he jumps up and you're like, but I didn't give him anything, so it's not access. As soon as you walk out of that door, you give him what you promised him, it's access, So let's be aware of our changing their environment by promising them something or by physically actually right then giving it to them. And it doesn't have to be a thing for access. It could be an activity. So if we say, oh, I'm going to give you tickles, then that is access to tickles. Or we're going to have outside time. That is also access. So if Susie has a tantrum, and immediately when that tantrum starts or during that tantrum, we give her something, we promise to give her something, we remind her of something she's going to get, or get this, we allow her to continue accessing something. Talk about that in a second. This is going to be considered an access maintained behavior or access function. And again, we don't go just based on one instance. We actually do our due diligence. We take our data for at least 10 different trials across 10 different settings. And we see, okay, was it access this time? What changed in their environment? Was it access? Was it attention? Was it escape? Was it sensory? Okay, continued access means that if we say, Susie, it's time to do your homework, and Susie starts to have a tantrum. Now, mind you, right now, Susie is watching her favorite cartoon show. We have to be very careful, and we have to be very vigilant to see, wait a minute, is she avoiding homework, or is she trying to continue access with her favorite TV show? So, continued access to something. If we say, Susie, it's time to come to dinner, and turn off your video game. And she does not turn off her video game. She starts to have a tantrum right in front of the video game while she's continuing to play the video game. Then most likely it is to maintain access to something, an activity or an item. If we tell a child, and this is a program often we'll do, and I always train staff on, do not say give me. We're not going to start off our give me program receptive instruction with a preferred. So let's say we have a kid that just loves yellow balls. It's just all the rave for them. We're like, okay, and Susie, give me the yellow ball. It may be that she has access to it. She doesn't want to give away access. She wants to maintain access. So let's be clear that it may be about maintaining access. And our last one, which is our most challenging for us to address, is going to be sensory or automatic reinforced. Now, what this means is that automatic reinforced, it means something on the inside. So if I start, scratching, and obviously I'm scratching, right? You can only imagine that I'm itching, that there's some internal sensation that's making me do that. You can't see it. You can see my scratching, but you can't see the force that's inside that's causing me to scratch. When I stop scratching, you don't know exactly why, because you don't see why. You don't see the nerves or neurons or whatever that are no longer in pain or that are no longer feeling uncomfortable. You just see, I did it and now I stopped doing it. We don't really know the reason. automatic reinforcement is the hardest for us to address because we can't see it. As a behaviorist, this is one of the only times that we're going to have to assume that, oh wait, she stopped scratching. That must mean that she's not feeling that internal sensation anymore. Okay, that has stopped. Otherwise, we're only looking at what we can see on the outside. So if we have a kid, for example, let's say Judy, head bangs. She bangs her head back on the wall. Bang, bang, bang. We don't know why she does that. A lot of times, individuals, teachers, professionals will jump to, it must be sensory. However, let's think about this. If Judy is not verbal, she bangs her head on the wall, that's a very dangerous behavior. Guess what? I bet you mom is running in. I bet you, sisters and brothers are like, what do you want? Because we want that to stop. And we're understanding that, oh wait, that's not a good thing to do. How can we get that to stop? This behavior may possibly be maintained by any of the other functions that we talked about, like access. Okay, now somebody's in the room, I get to point to my PEX picture and let them know what I want. Or nobody was in the room and now I got somebody in the room and I get attention because now they're going to try to occupy me with something else so that I stop doing that behavior. Or it could very well be that Judy is experiencing some type of internal aversion that pressure brings relief to. Could be. And so this is why sensory or automatic maintained is the hardest for us. One is because usually with an automatic maintained, we somehow attend to it. That's how we know that it's occurring. And depending on how we attend to it, if we're perceiving that this child needs to communicate with us, we may give them communication options, which is kind of options for access, Now, one of the telltale signs of a sensory or automatic reinforced behavior is that generally it does not discriminate in different settings. Now, we may see a spike at certain times of the day because let's say that a child is, just rubbing their skin a lot or something like that. We may notice that happens a lot on a hot day because maybe they're sweaty or it's uncomfortable, or it may happen, at certain times when they're having some type of maybe very mild allergic reaction or something like that. But you can see all of the maybes and ifs and da-da-da. So whenever we're thinking a behavior, maybe a sensory maintained behavior, or a automatic reinforced behavior, we're probably going to need double or triple the data just to make sure that we're not able to find a pattern within that leads to another, behavior. So I will give you the example, and I've dealt with this a ton, and sensory and automatic behaviors are the most rare, to be quite honest. I had a kiddo and he was about 6 years old and he was in school, and when we started to work with him, it was 2 years after he worked with another ABA company, and he was said to headbang for sensory. And so what they did is, even in school, when he banged his head on the concrete, which poor fella, he would do that, or the wall or the desk or anything, they would just back off because they're like, we cannot allow him to continue to harm himself. And I 100% agree that we have to maintain safety first as a most priority. However, after I did my data, I realized that this kid was actually, engaging in that behavior for access. Every time he did it, if he was at school, the activity got changed because obviously that was his way of communicating. I didn't like it, and the teachers understood. He doesn't like that. Let's switch it to something else that he does like. When he was at home, things were given to him so that he would be distracted and calm down. And so simply put, this was a nonverbal child. We added in not verbal communication, but we added in communication via a technology type of system. And I first got him I had his mom to get him fitted for a helmet. And as we were waiting, it took a couple of weeks for that to happen. We took data. And when she got that helmet, it was like, okay, natural consequence. If it looks like you're about to try to bang your head on something, then you're going to put the helmet on. However, before, you have that opportunity to bang your head on something, we have your communication cards with you. We have your technology system with you. And we are constantly presenting you, like every 5 minutes, do you want something? Giving you the opportunity. And then when you bang your head, you are not getting access to anything for the next 5 minutes. We're letting that be established. That banging head is not going to trigger us. It's not going to trigger the change in your environment to now gain access to something. So there are your 4 functions of behavior: attention, escape avoidance, access, continued access, sensory. 4 functions: attention, escape, access, sensory. All right, hope you guys learned something. Take care.